Good morning, I'm Marilyn Salazar and I'm here today to present to you about the topics of health promotion for Aboriginal and Torres Strait Islander people with cardiovascular disease in the remote area of Australia. This is a group representation for the Aboriginal Torres Strait Health Islander Unit. I'm going to discuss also the links between culture and health, healthcare context, health needs, and health issues that we've selected in the learning guide criteria. And also, I'm going to discuss the social determinants of health for cardiovascular disease in Aboriginal and Torres Strait Islander. And lastly, we're going to discuss the application of culturally safe nursing practice and the conclusion and the summary of this topic. So let's have an overview. So, cardiovascular disease such as ischemic and stroke are the top leading cause of death in Australia, specifically in Aboriginal and Torres Strait Islander people. There have high prevalence rate of mortality among the younger Aboriginal and Torres Strait Islander people who are living in the remote area due to cardiovascular disease. The importance of Aboriginal and Torres Strait Islander culture towards the healthcare services in the remote area. We are also going to discuss the interrelationship of social determinants in developing cardiovascular disease to the Aboriginal and Torres Strait Islander people, and also healthcare services that are available in the remote area to prevent the prevalence of cardiovascular disease. Moreover, we are also going to discuss the impact of culture to the healthcare services for the Aboriginal and Torres Strait Islander people in the remote area. And lastly, we are going to discuss the effective and competent nursing strategies in improving a quality health of the Aboriginal and Torres Strait Islander people who are residing in the remote area of Australia. There are three aims that we're trying to achieve in this topic. The first one is to promote optimum health among the Aboriginal and Torres Strait Islander people who are living in the remote areas of Australia. The second one is to prevent the prevalence rate of morbidity and mortality rate of cardiovascular diseases towards the Aboriginal and Torres Strait Islander people in the remote area. And lastly, to prolong the life expectancy of every Aboriginal and Torres Strait Islander people in the remote areas through implementing the culturally and safe nursing strategies and by improving the healthcare delivery system. Our main objectives for this are to increase health awareness of the Aboriginal and Torres Strait Islander people about cardiovascular disease through health education, to build a good partnership between the healthcare professionals and Aboriginal and Torres Islander people in the remote area, to encourage the Aboriginal and Torres Strait Islander people to access, avail, afford, and attain the healthcare services within their area, to ensure that the cultural health aspect of the Aboriginal and Torres Strait Islander people is included in the health promotion, wherein it will reduce the incidence of cardiovascular disease in the remote area of Australia. And lastly, to emphasize the social determinants that will influence the health of Aboriginal and Torres Strait Islander people in developing cardiovascular disease within the vicinity of remote area in Australia. Links between culture and Aboriginal and Torres Strait Islander health. Connection to country. The first inhabitant in Australia are the Aboriginal and Torres Strait Islander people. They are the one who originally lived here in Australia before the colonization. The adaptation of Aboriginal and Torres Strait Islander have their own culture. They view the land as their life. They are spiritually attached to the land, water, flora, fauna, air, soil, rocks, trees, salt, and fresh water. However, due to the colonization, they adopted some traits from the Western culture. Example, change of diet, alcohol consumption, tobacco smoking. When it comes to the collective society perspective, European social classification between upper, middle, and lower classes influenced the perspective of the Aboriginal and Torres Strait Islander people towards the society, which leads to have the clash between the Aboriginal and Torres Strait Islander people and British people. The stolen generation has a great impact for them that leads to intergenerational trauma, loss, grief of Aboriginal and Torres Strait Islander people. Connection with health services. Awareness about the importance of land, culture, spirituality, ancestry, family, and community. The culture and experiences of their ancestry affects their perspective towards health services. Strong self-determination in cultural and health affairs. Perspective of health and illness. Medicine's attitude to health professionals. Health is holistic for Aboriginal and Torres Strait Islander. They hold a strong faith in bush medicines and bush stock rather than modern healthcare delivery system. Racism due to the incident that happens during the invasion of Western people. According to the 30th of June 2011 census that was released by the Australian Bureau of Statistics last 2013, 3% of the Australian total population is considered as Aboriginal and Torres Strait Islander. However, 30% of the proportion in the population of Northern Territory belongs to Aboriginal and Torres Strait Islander. Remote area considered as a far-flung area wherein there have a poorer access in the healthcare services because the health facilities are usually located in the town of the community. It is also a far from civilization or town and requires a long travel hours wherein transportation is very seldom and quite not accessible for individual. One part of the Northern Territory is the Western Arnhem Regional Council, wherein four of its area are considered the largest remote town in Northern Territory. These are the following: Gunbalanya, or known as Owenpelli, Maningrida, Bara, and Kakadu. The total population in these four remote areas are nearly 7,000, wherein two-thirds of the population are Aboriginal and Torres Strait Islander in origin. Some people in this location consider themselves as Birinwinku, which means freshwater people. There are health services that are available for the people who are living in the remote areas of Western Arnhem Regional Council, such as Gunbalanya, Maningira, Bara, and Kakadu, and those health facilities are located in the town. The following services are community aged care packages, disability in home support service, home and community care, indigenous aged care employment program, active remote communities, youth sport and recreation program, community night patrols, community development, job creation, and mentoring program. According to World Health Organization, health promotion is the process of enabling people to increase control over and improve their health. It also defines as to helps the individual to determine the social and structural determinants that will affect the improvement of health. The significance of health promotion to the individuals and communities are the following: improves quality of life because they will be aware of the healthy lifestyle that they can consider in their daily living. Health awareness and healthy community. As soon as they imply the healthy practices that has been taught to them, the life expectancy of the Aboriginal and Torres Strait Islanders will rise up. It will also reduce the incidence of acquiring a disease because they will be more health conscious and knowledgeable about the impacts of cardiovascular to their health. It will also affect the high life expectancy through healthy lifestyle. It helps to improve the healthcare services by availing them and implements necessary programs to prevent having cardiovascular disease in young age. How does our chosen healthcare need impacts on individuals or communities? In the Ottawa Charter of Health Promotion, it will impact the community through enabling immediate advocate, develop personal skills, strengthen the community action, create supportive environment, and reorient health services. Working hand in hand will achieve an optimum health. And also, second, the community health improvement through collaboration with other agencies that are willing to extend their help in providing necessary things in improving health. Who will benefit about this one? Uh, the Aboriginal and Torres Strait Islander people will benefit this in this health policy or everyone across the world. The health issue that we choose is cardiovascular disease. What is cardiovascular disease? Cardiovascular disease is a condition wherein the blood vessels are getting narrow or being blocked, which leads to chest pain and results to heart attack or stroke. There are two contributing factors that cause cardiovascular disease, such as modifiable and non-modifiable risk factors. Modifiable risk factors can be changed. For example, obesity, smoking, high blood pressure, high cholesterol, poor diet, physical inactivity, and alcohol consumption. Whereas non-modifiable are those factors that we cannot change, like genetics, sex, and age. According to the Australian Bureau of Statistics 2015, cardiovascular is one of the top leading causes of death here in Australia. For around 14% of Aboriginal and Torres Strait Islander, this is the primary cause of their mortality, particularly ischemic and stroke. In the 2012 to 2013 Australian Aboriginal and Torres Strait Islander Health Survey biomedical data, about 12% of Aboriginal and Torres Strait Islander people have heart disease and 17% in the remote area develops heart disease at a younger age. The incidence of acquiring heart disease is twice higher in males and twice higher for females when it comes to hospitalization. What are the cultural implications of this? Understand and respect the culture. This is helping us to gain their cooperation and avoid any issues. Appreciating their culture. It is relevant because it is part of them as an individual, unique individual. We have to treat them as a unique individual because every clan have different traditions and beliefs. Active participation in the health community programs, including their cultures in the activity program, will encourage them to join the group. Collaboration between the health provider and Aboriginal and Torres Strait Islander people. Good partnership will lead to attain a better health outcome. The relevant Aboriginal and Torres Strait Islander social determinants of healthcare chosen health issue. The first one is the gender and culture. Female is more susceptible in developing heart disease. Ischemic heart attack is 2 times higher in males and 3 times higher for females according to hospitalization. Rheumatic heart disease is 4 times higher in male and 9 times higher in female. A second determinant is the biology genetic characteristics. Aboriginal and Torres Strait Islander is more prone to have cardiovascular disease than other Australian. Third, health services resources. The health services that are available in the remote are restricted. Inadequate supplies and medical shortages affects the views of Aboriginal and Torres Strait Islander people towards health. Public hospitals are available in the remote areas, however, the bed is very limited. Primary health care services that are available are the medical assessment by a health practitioner or registered nurse, blood pressure check, wound management, anticoagulant therapy, Aboriginal and Torres Strait Islander health, all ages, pain management, X-ray, cardiac assessment including acute rheumatic fever, rheumatic heart disease, and blood lipids, rehabilitation, cardiac educator, cardiologist, vaccinations, cancer, alcohol, and other drug assessment. When it comes to health practices and coping skills, the Aboriginal and Strait Islanders believes in the effects of bush medicines, herbal medicines, traditional faith healers, and black magic. They are consulting the traditional faith healers instead of going to the healthcare providers when they are sick, and also they view death as caused by a black magic. Physical environments, overcrowding and rundown housing contributes to poverty in Gunbalayan and other remote areas in Northern Territory. Social environment, Aboriginal and Torres Strait Islander people have a sedentary lifestyle such as smoking, drinking alcohol, not exercising, not eating well, overweight, which contributes in developing a heart disease. Employment and working conditions. Farming and hunting is their first occupation before the colonization. Anyhow, in the past year, unemployment rate for the Aboriginal and Torres Strait Islander people in the remote area is going up. Due to increasing rate of unemployment in the Aboriginal and Torres Strait Islander, some of them, particularly those young people, are forced to work. Employment has an important outcome for health, social and emotional well-being and living standards of Aboriginal and Torres Strait Islander people. Education and literacy. Uneducated and illiterate. Some of them are not going to school. However, learning is influential in achieving an optimum health. It increases their knowledge, which leads them to control their behavior towards alcohol consumption, food intake, and physical exercise. Culturally competent and safe nursing and midwifery practice. As a nurse, we have to abide the code of conduct for nurses, specifically the principle 3 when it regards to cultural practice and respectful relationship. First, Aboriginal and or Torres Strait Islander people health. According to this principle, the healthcare provider should provide a holistic care which is free from any bias and racism, culturally safe practice, and respect for every Aboriginal and Torres Strait Islander people. Second is to access the quality and culturally safe health services for Aboriginal and Torres Strait Islander people, and to emphasize the importance of family, community, partnership, and collaboration in the healthcare decision making of Aboriginal and Torres Strait Islander people. The second principle talks about the culturally safe and respectful practice. In the Aboriginal and Torres Strait Islander culture, it is important for them to include their family towards the care that is necessary for the Aboriginal and Torres Strait Islander. And also, we have to respect their cultures and beliefs towards health. And the third one is the effective communication. Clearly and accurately communicate with the Aboriginal and Torres Strait Islanders. Healthcare providers should be aware about the way how they communicate. Cultural awareness is necessary because everyone have different cultures. Cultural sensitivity. Identifying the cultures will help us to avoid the problems in delivering healthcare services. Respect and understand the cultural practices of the Aboriginal and Torres Strait Islander people to establish trust and rapport. Being aware about their verbal and nonverbal communication techniques will facilitate an effective working relationship. Cultural considerations towards their healthcare practices makes them participate in achieving an optimum health. Health education about developing cardiovascular disease will broaden up their knowledge and helps to promote a healthy community. Establishing report will make it more convenient for the Aboriginal and Torres Strait Islander to avail and access the health services that they really need. Encourage them to exercise for 30 minutes every day. And also, we have to encourage them to eat fruits, vegetables, and fish and reduce the consuming of fatty foods such as meat. Educate them about the standard alcohol intake per day. Advise them to have at least 8 hours of sleep every night. Educate them about the effects of smoking to their health. And emphasize to them the importance of 2 to 3 liters of fluid intake. And lastly, encourage them to consult a medical officer for general checkup annually. Enhance them to participate in the community activity, blood pressure monitoring and availability of blood pressure equipment, blood cholesterol, lipids, blood sugar, and other laboratory workup which is necessary in diagnosing a cardiovascular disease. Conclusion: we therefore conclude that cardiovascular is the main cause of death in Australia and also to the Aboriginal and Torres Strait Islander people who are living in the remote area. Social determinants have a major impact in the health outcome of every Aboriginal and Torres Strait Islander people who are residing in the remote area of Australia. Alcohol, smoking, obesity, education, unemployment, family history, diet, physical inactivity, and other complicated diseases such as diabetes mellitus and chronic kidney failure are the major contributing factors in developing cardiovascular disease of the Aboriginal. Nursing strategies that will apply in every Aboriginal and Torres Strait Islander people varies in their own cultural perspective because every person who are living in the remote area are from different backgrounds. Health promotion is an effective tool in improving the health of Aboriginal and Torres Strait Islander people who are living in the remote area. Following the Code of Conduct for Nurses 2018 will assist us in how we are going to deal with the Aboriginal and Torres Strait Islander people. In addition, it will help us to deliver an effective and culturally safe nursing practice in our future workplace. As a nurse, in the future, we are responsible in promoting health to individuals despite of their nationality. Nurses and other healthcare providers can influence the beliefs of people through giving a factual information about the health. Working and respecting each other will help us to improve our healthcare delivery system. To sum up this topic, we're going to summarize it that there are many underlying causes in developing a cardiovascular disease. However, we can prevent it by implementing a healthy lifestyle. Health promotion is necessary in improving a health outcome, wherein culture makes a big impact in every aspect of an Aboriginal and Torres Islanders people's life. Social determinants can have a good or bad outcome to the health of every Aboriginal and Torres Strait Islander people who are living in the remote area of Australia. The effectiveness of care is depends in the willingness of the Aboriginal and Torres Strait Islander people and it also depends on the determination of the healthcare providers who are willing to serve and share their knowledge in the people who are living in the remote area. To sum up, culture has a big effect towards the perception of Aboriginal and Torres Strait Islander people about health. Health is one of the very important aspects in life of a human being, not only for the Aboriginal and Torres Strait Islander people. Knowledge deficit and presence of health threats such as modifiable and non-modifiable risk factors can cause a disease to an individual easily.